But what does mental illness is? One of the things that we talk about is having mental health in our lives, but what is mental illness? Well, let's talk about first is a health condition that involves significant changes in the way we think. So there's some thoughts distortions in the way we feel, our emotions, and in the way we behave. So it causes distress in our lives, and we can have issues such as functioning problems at school, at work, in social environment, and even in our relationships. I know that some people who have mental health issues believe that they don't have a mental health issue because, for example, somebody who's drinking is like, oh, I drink and then my drink, but I function. But when you ask the family members and other people in their family, they say, not exactly. I mean, things are not going well with their drinking. So what are the prevalence of mental illness in the United States? 1 in 5 people in the United States, 19% of adults in the United States, and those are millions of adults in the United States, have a mental illness. 1 in 24, 4% of that 19% has a serious mental illness. And then 1 in 12, that's 8% of our population, have a diagnosable substance abuse disorder. So that's how crucial mental health is in our family, because it impacts all of our functioning in our lives. So mental illness is a medical problem. One of the hardest things that I deal with as a therapist is to find that sometimes people are like not wanting help. And I tell them, if you had a heart disease or you had diabetes, would you not take a medication? Like sometimes people need medications for mental health issues. And they're like, yeah, but that's not the case. And I'm like, yes, it is, because this has to do with your brain not having, for example, in depression, the neurotransmitters that produce serotonin in our brain are not properly functioning. So having a medication to help that sometimes is necessary. But we don't say to a person who has a diabetes, hey, don't take your insulin. You don't need it. Buckle up. Do the best you can. No, we kind of have more of a stigma behind mental illness, when in reality is a medical problem of our brain. That's just part of our body as any other part of our body, as cancer or anything like that. We don't say to somebody who has cancer is in their bed suffering, they don't say, get up, try to do something. You're gonna, get better just out of the nowhere. So we kind of have to be conscious that mental illness is in fact a medical problem, and it's a serious medical problem that impacts a large number of our population. So if mental illness impacts our everyday life, what is mental health? And that is a state of well-being. So how do we know that somebody's having mental health? How do we know that a person has a well-being, a state of well-being? Well, the person is able to realize his or her own abilities and cope with everyday normal life stresses, can work productively, be fruitful, and contribute to our society at large. Challenge is then, how do we help people maintain that mental health status where they feel in the well-being? We confront challenges every day. Right now with the coronavirus, we have seen increases in everything. In the last few years, we have seen an increase in the suicide rates in the younger population. We really have to look at more closely what are the things. Our spiritual, physical, mental health being as a complete whole of integrating ourselves. In the next few weeks, we're going to be talking about caring for our mind. And I'm going to be talking about the specific components and things that can help improve your well-being. We'll talk about, for example, one of the most popular ways of dealing with depression and anxiety is cognitive behavioral therapy. One of the things that often I discuss with people is cognitive distortions, ways that we think that really create problems in our relationships and in the way we see the world. So we're going to be talking about those distortions. We're going to be talking about mindfulness. How do we pay attention to the present moment instead of worrying about the past or worrying about what's going to happen in the future. That's some example of some of the things that we're going to be talking about. The main part is care for your mind. So for this week, one assignment that I'm going to give you, sorry, I like giving assignments. So it's about how to breathe. You're going to say, what? Breathing comes easily. No, we don't. We sometimes take shallow breath. So take a deep breath through your nose, hold it in for a few seconds, fill your lungs, and slowly release. Try to practice that every day, several times through the day. You're going to find that you're going to feel more calm throughout the day. We'll see you next time in our session, Caring for Your Mind.